Welcome to Country Doctor House Calls. I'm Dr. Adam McCall, a family physician practicing old school medicine in a modern world. This podcast is about truth over trends, relationships over algorithms, and common sense over noise. We'll talk about real medicine, bad medical advice, faith at the bedside, fatherhood, and what I've learned from thousands of patient visits. These are conversations you'd have if a country doctor pulled up a chair on your front porch and told you the truth with clarity and with care. No hype, no shortcuts, just honest medicine for real life.
It didn't happen overnight. It happened slowly, layer by layer, policy by policy, incentive by incentive. Somewhere along the way, we stopped designing it around people and started designing around the system. So this is what we're trying to do. I don't want to burn insurance down. I'm not pretending that this is just simple, but it kind of is. But by deliberately realigning care around three basic goals: better access, lower cost, and higher quality. And by doing that, by treating people with integrity and transparency, even when that could be inconvenient. So let's start here. Access. Access sounds like a buzzword until you've lived without it. Until you're a parent trying to get a sick child seen and being told the next available appointment is in 3 weeks. Until you're working at a job, no flexibility, no paid time off, trying to figure out how to take even just a half a day to sit in a waiting room for 7 minutes, and the clinician's already behind. You've all been there. Access is not about having insurance. Access is about time. It is about proximity. It's about being able to reach someone when you need to, not just when it fits into a schedule. One of the great ironies about modern healthcare is that we have more technology than ever before, yet people feel more disconnected than ever. We have apps, we have phone trees, we have ideas, we have portals, we have messages. Everyone is reachable, yet no one actually is reachable. Improving access means lowering friction. I had a nurse ask me recently, what does it mean? It means fewer hoops. It means asking, what does this person actually need right now, instead of what box needs to be checked. Sometimes access means same-day visits. Sometimes it means answering a question before it turns into an emergency. Sometimes it means recognizing that not every problem needs a hospital, a referral, or a stack of forms. And here is the key part. Access should not be reserved for people with the best insurance, the most time, or the loudest voices. If care were only accessible to the people who know how to work the system, then the system is failing at its most basic level. And then let's talk about cost. My gosh. Cost is the elephant in every exam room, even when no one says it. Patients think about it constantly. Clinicians are often shielded from it and don't even understand that they're part of the problem. For too long, healthcare is treated like a downstream issue. The cost of it is. But cost matters because cost defines behavior. It determines behavior. High cost delay care. High cost turn manageable problems into crises. High cost force families to choose between medications, groceries, between follow-up visits, or rent. So why are we not addressing this? Lowering costs does not mean cutting corners. No, it does not. It means cutting waste. It means asking hard questions about why things cost what they cost. It means being honest when something is not necessary and courageous enough to say so. It also means transparency. One of the most frustrating things for patients is not just accessing healthcare, but finding out that it's unpredictable and it's expensive. People accept a lot if they understand it. What they cannot accept is surprise bills, hidden fees, and vague charges. So why are we not more transparent? Transparency, it builds trust. When people know what something costs, why it costs that much, and what alternatives exist, they can make informed decisions that aren't radical. But there's a deeper issue. When clinicians are actually shielded from cost, we lose a very important part of stewardship. Medicine is not just about doing everything possible. It is about doing what is appropriate, what is effective, and what is responsible. This brings us to quality. Quality is so often measured in metrics, in some sort of standard, in a checklist, and some of that, if not a lot of the time, misses the mark. It's not useful. Quality is not just whether a protocol or a guideline or a checkbox was checked or followed. It's whether the patient understood the plan, whether or not they felt respected, whether or not that care made their life better, not just their chart look complete. Man, see this all the time. It's not about just continuity. It's seeing the same person over time, being known, not having to re-explain your story at every visit. knowing the difference between when someone complains and doesn't complain. Quality is about judgment, knowing when not to order a test, knowing when reassurance is better than intervention, knowing when to slow down. It's also about accountability, owning your outcomes, following up, not disappearing once the visit ends. And here's something that doesn't really get said enough. Quality and efficiency are not enemies. Rushed care is not always efficient care. Fragmented care is not often cheaper, but the most expensive care is often care that comes after something was missed, handled poorly, or just delayed. So, how do we improve access, lower cost, and raise quality at the same time? Doesn't that break the rule of three? It does. But the answer, I do believe, is surprisingly simple. By grounding everything in how we treat people. Love thy neighbor as thyself. Integrity matters here. Integrity means doing the right thing when no one was watching. It also means when everyone is watching. It also means doing it by the time that you said that you would do it. It means recommending what is best for the patient, not what is best for a metric, not what is best for an insurance contract, or merely a quarterly report. Being willing to say, I don't know, let's figure it out together. It's acknowledging uncertainty instead of hiding behind authority. Integrity also means consistency, treating people the same regardless of their background, their insurance, how they smell, their economical or political standing. The exam room should be one of the few places where human dignity is not conditional. Transparency matters just as much. Transparency means explaining decisions. It means inviting questions. It means not using complexity as a shield. Patients don't expect perfection. They expect honesty. They expect to be treated like adults who can handle the truth. When care is opaque, trust erodes. When trust erodes, everything falls apart. And that's where we are. This is the mic drop moment. Adherence drops. Relationships weaken. Medicine, health, economics, every single thing that we are about suffer. But no one can get it. Everybody puts their own needs in front of everybody else. Lawmakers are doing it. Insurance companies are doing it. PBMs are doing it. You have to pay to play. You want to make a change? It's going to cost you $100,000 for someone who is legit trying to make a change in law. Why? Because lobbyists are out there pushing it. They're getting paid by big insurance companies. They're getting paid by whoever is benefiting from the system that is wrecking you. True. Tangent. When care is transparent, something remarkable, though, it begins to happen. People engage. They take ownership of their health because they're not participants. They're not just strangers to the system. They're actually a part of it. There's also a moral dimension to this, right? Healthcare, that exam room is one place that people will show up at their weakest moment. They're afraid. They're in pain, they're uncertain, which creates this ethical responsibility that goes beyond customer service. Treating people well is not an add-on, it is the foundation. That means listening without interrupting, it means not assuming, it means recognizing that behind every complaint, there was a person who walked in that door that had a story. And that story will make so much more sense if you just take the time to hear it. But it also means designing systems that support humane care instead of undermining it. Clinicians cannot practice integrity if the system punishes them for spending time, for thinking, for caring, or there's moral injury because they want to, but they can't because they can't make enough money to support their staff, or their clinic, or their family, or they're having to chase money that was owed them for the service that was provided 90 days after the fact. That has always been hard, but it's getting harder. But there was time when the relationship was at the center of the physician and the patient. There was no more obstacles to it. Now there's so many more obstacles. What are we trying to build then? Trying to build something that acknowledges reality without surrendering to it. A model that accepts that healthcare is complex but refuses to believe that complexity excuses dysfunction. We believe access can be better, not perfect, but better. We believe that care can cost less, not by rationing, but by being just honest about what the care costs. And then when we have that, we can be smarter about how to spend it. We believe quality can improve not through more boxes, but deeper relationships. A core principle that we also believe is that we believe that how we treat people matters as much as what we treat. If you get the culture right, many of the other problems become solvable. If you get the culture wrong, there's no amount of technology or AI or funding that will fix it. At the end of the day, this is about trust. Trust that someone answers the phone. Trust that the advice you are given is sincere. Trust that the system is not trying to confuse you or profit from your fear. The trust is fragile and it takes time to build and seconds to lose, but is the most valuable currency in healthcare, and we can't buy it. So this is the goal. Care that is accessible because it respects people's time and their reality. Care that is affordable because it respects people's lives and their limits. Care that is high quality because it respects the people enough to do it right. And all of it grounded in integrity and transparency, not because it sounds good, because that is the only way that it works. So that is what we're building. It's not flashy. It's not complicated. It's something that's honest. And to be matter of fact, it's what people like you and me need to expect. And in healthcare today, that might just be the most radical thing of all.